Do you feel like you have knee pain when you're walking up the stairs or down the stairs? And when you're beating up in walking? Don't just rub your knee. The problem may not be in your kneecap. Hello everyone, I am Becky Lau. I am the founder of East-West Bodyline, and I'm also a body worker. Today, I'll explain to you in simple words from both the West Fascia approach and also the East Meridian approach why old people always have knee pain and how to use true simple acupoints to relieve your knee pain. In Western sports medicine, there is a fascia line called the superficial front line. This fascia line connects from our face, anterior neck, to our pectorals, to our chest, to our abs, down to our quadriceps, and then to our anterior shin, and then to the anterior surface of our foot. As aging occurs, this fascia may dehydrate, which means it may dry up. When it dries up, the fascia loses its tensibility and also its elasticity. When aging occurs, this fascia may tighten up and dehydrate by itself, causing us to unconsciously tighten up our body and become in slouch position, just like this one. As a result, this tightened superficial front line may pull the elderly front side downward and cause the elderly to bend their back and have kyphotic back unconsciously. As time progresses without improvement, the center of gravity of this person will be shifted towards, which is right onto the kneecap if the person do not increase on their cushion. All the body weight of this person is down on the kneecap. At first, they will only feel pain when they walk up the stairs, when they go on a steep slope. But after time, they may even feel the pain even when they're just merely walking, or even when they are not moving. This is the reason, according to the SML, according to the Western sports medicine. However, what makes me feel is interesting is that this modern myofascial views actually aligns with the TCM traditional view, when we can see that the superficial front line of the anatomy traits actually share very similarly with the TCM stomach meridian. In TCM, the stomach meridian is the meridian that extends from our eyes below the eyes and then go down to the anterior surface of our body, going down to the side and then wrap around our kneecap and then going down to our second toes. This sounds similar, right? It actually shares very similar paths with its superficial front line of the anatomy trait. Crucial acupoints of this meridian, like the ST34 and ST35, actually are sitting right above the patella, which means any disruption to this stomach meridian of TCM may cause knee pain. As we all know, the stomach and spleen are responsible for digestive system. That is to convert the energy in the food into the energy that we can utilize in our body, which also can hold to the fact that in the TCM, the stomach and the spleen and meridian are responsible for the energy of our flesh. And as we all know, the quadriceps muscle, that is the muscle that is wrapping around our kneecap, is a very thick muscle in our body and responsible for all the anti-gravity movement. Which means if the stomach meridian really declines as we ages, the quadriceps muscle will be affected severely as the nourishment provided to this muscle will decline as the stomach meridian declines. This theory of TCM is actually proved by modern science, which clinical studies have shown that the gastrointestinal problems is the most comorbidities in aging people with joint pain. So this actually highlights the link with digestion, and I'll also show the key in modern science. Okay, now we have established the link between the Western fascia and also the Eastern meridian. We see how common they are, right? Now I'm going to teach you 2 acupoints to help to release this fascia, this meridian, to help with your knee pain. This acupoint is called the Zusanli ST36 Acupoint. It is right below your kneecap. You can first glide your kneecap to poke the most prominent patella bone, and then find the cord that you can in right at the side of your patella bone. And then we put 4 fingers downward. It is 3 trunk in Chinese medicine. And then this point is the Zusanli acupoint. This acupoint is right next to your tibia bone, about 1 finger breadth next to your tibia bone. Stimulating this ST36 point can help you to release the lower portion of the superficial front line according to the fascia. As we know from the superficial front line, the fascia between the side and also the shin anterior side is connected. That's why if we can stimulate this point, relax this ST36 point, it can actually spoke the tension from the thigh to go over to the sheath, which means the pressure on the kneecap is released. The second acupoint of the stomach meridian I'm going to teach you guys is not as popular as the first one. It is called the Wuyi ST15 Acupoint. It is right at the second intercostal space, right above our nipple. When we press on it, we can instantly feel a sore in this point, and that is the point that you should find. If we explain it from the superficial frontline fascia approach, we can see that actually this Wuyi acupoint belongs to the superficial front line and is a part of the pectoral fascia, which means our chest. Most of the senior people, they walk with slouched forward head posture, which stems from their chest type. If you look at the elderly walking, we seldom see them walking as the young people, as upright and as straight as the young people. Most of the old people, they walk with a slouched forward head kyphotic back posture. This can actually be explained by the Western fascia because of the tighten up pectoralis muscles. Why do we use an acupoint from the chest to help to deal with our knee pain? It is because not only because it is belong to the stomach meridian, which is responsible for our knee. The other reason, if we explain it from the Western fascia approach, actually in the superficial front line, the pectoralis muscle, the pectoralis fascia, is connecting with the side and then the kneecap, that is the fascia, right on our kneecap. That's why if we release this ST15 acupoint, it can help us to release the full fascia of the superficial front line and release the pressure on the kneecap. When we look at the elderly walking, we rarely see them walking upright just like the young people. But what is the reason behind? Actually, the reason behind is because they have very tight, the tight pec muscle cause them to slouch forward, and then the center of gravity is pulled forward right on their knee. That's why they always have untriggered knee pain, even if they have done a lot of massage, but a lot of things on the knee. Because the center of gravity is not improved, the chest is not improved, and that's why they have constant knee pain. This ST15 acupoint is very good for relieving upper portion of the superficial front line and hence release the tension on the kneecap. Let me recap how to find it. This acupoint is right above our nipple at the second intercostal space. How do we find it? It's actually we just square our nipple and then we put about 3 fingers on it. That is a point that is very sore. And then when you press it, you can use your thumb, the mid of your thumb, to gently massage it. Each time I would usually do it for 1 minute to 3 minutes and 3 times a day until you feel that the point is released and your whole body feel more relaxed. And then you can go up and stand and walk again. You can feel that your knee pain will be released if your problem is originating from the chest tightness. Okay, to wrap up, today I've explained why the knee pain is consistent from both the Western and also Eastern fascia and meridian conflict. To release the pain of the knee, we should use the acupoints of the stomach meridian, including the 2 that I have taught you today, the Zusanli, also Wuyi, ST15, ST36 Acupoint. If you find this video useful, please try to subscribe and also comment below what acupoint and what pain you want me to help you to release from the Eastern and also the Western point. Thank you for watching. Have a nice day.